Good evening, Matador family. Thank you all for taking the time to tune in to this virtual town hall. I'm really excited about this particular town hall because it's going to be a little bit more interactive than what we are accustomed to, and I'll share a little bit more about that here shortly. But I do want to just share that today was the first day back for our teachers, and they are excited about the upcoming school year and are eager to start and eager to see their students, whether it's virtual or face to face. I saw a lot of great things happening on campuses today, whether it was by visiting or through social media. I'm just really proud of the efforts that the campuses have made to ensure that safety protocols are in place. I was very pleased to see the social distancing, the use of masks, the sanitizers, and so I'm just very hopeful that the first day of school is going to be a success. I wanted to first start as I do every town hall by just sharing current state of the COVID situation, and I want to share that we did have a student athlete that did test positive, one of our middle school students, and of course that student is in quarantine. Fortunately, athletics has some really good systems in place to ensure safety, and I'm very proud of those efforts. Uh, the middle schoolers have been outside, so that also helps and also affords more opportunity for spacing. So this week, the middle schools were taking a break anyway, but it is my hope that our student recovers very soon and is back with us quickly. As far as how things are going in the Seguin community, uh, we have the positivity rate is certainly decreasing. As I've shared before, don't put a lot of stock into that for various reasons. One is that the county doesn't have its own health department where we're gathering data from the hospital, from physicians, and compiling it in one place. So the best that we have is the data that we're getting from our hospital. And that positivity rate right now is at 8%. The positivity rate last week was at 17%, and during the surge of COVID, it was around 45%. So that's one thing that we could look at that has improved, whether you find that data to be reliable or not. But that's significant if you think about it, from 45% positivity to 8%. The hospital yesterday was at one point at 0 patients with COVID. However, there is now one patient currently hospitalized with COVID. And if you remember last week, those numbers have significantly dropped compared to where we were during the surge. Some other hopeful news that I'm glad to share today is that the temporary ICU unit that was put up for non-COVID patients has been closed. There's no longer a need for that unit. And as I mentioned, there's only one person hospitalized with COVID. As far as the number of tests that the hospital is conducting right now, that average per week is at 100. During the surge, it was anywhere from 300 to 500. So we are seeing things improve. And if you look back on what has changed from that time, there's been some mandates that have come into place as far as the use of masks. And you can't go anywhere in any business without a mask on. And I think that certainly had an impact. The mask, it's science-based, research proven that masks make a difference. In addition to that, we're spending more time outside and not confined indoors, and that certainly makes a difference. What will be telling is after Labor Day, what the trends look like, because one, we're starting to get again a false sense of security. In addition, people typically gather in crowds during Labor Day, many times indoors, and when you're with people that you're close to, you may be very comfortable and not feel like you need to wear a mask. So I just want to stress the importance of continuing to take every precaution to stay safe. We want to get through this pandemic. We want all of our kids with us. We want to be back at 100%. And so I just want to stress the use of mask. And I'm just proud that I'm in a school district where the staff, where the board, where the community supports the decision to implement the use of masks in our schools. And I am confident that those measures are going to make a difference. And there are some highlights that I want to share that prove that taking those precautions make a difference. And so as I highlight this, I also want to celebrate our child nutrition team, along with maintenance staff and transportation staff who have supported them since school closure back in March. We have served over 300,000 meals since school closure. 300,000 meals. So if you think about the amount of work that goes into that, the level of teamwork and collaboration and handing out meals, and we did not have to close a site that entire time period or completely cease operations of distributing meals, where many other districts had to. So I'm very proud of the fact that our staff, even in the heat, even when it's uncomfortable, they followed all safety precautions because they really wanted to make sure that our students had access to nutritious meals. Our athletic program over the last several weeks has worked with hundreds of students, and we've had minimal issues. Our coaches follow very strict protocols, and I'm very proud of the work that they're doing, and not only the coaches, but the commitment from our students. So I certainly wanted to celebrate that and share that information with you all. As many of you all are aware, that we shared a link to garner some feedback utilizing Thought Exchange. And so I'm very excited about today's town hall. And I have a guest here from Thought Exchange, Laura, who's going to help facilitate the conversation today. And I just want to celebrate the level of engagement that we've seen from the community and from the staff. It's unbelievable. I expected, because we're an engaged community, that there would be a high level, but I'm just amazed at the level of participation. So with that, I'm going to hand it over to Laura with Thought Exchange.
Hi, everyone. Thanks, Dr. Gutierrez. Can everyone hear me okay? Great. Okay. So thank you so much for inviting me here this evening to facilitate this. I work with school district communities across Texas, and it always is a privilege to attend these forums. So I hope that some of you who are here, most of you hopefully had a chance to participate in the community-wide thought exchange that was sent out. In that exchange, you were asked a simple open-ended question. And that's really, what is top of mind for you as the school year is starting? So if you didn't get a chance to participate, that's okay, because we're going to open it up in a moment. But really, you were asked to respond to this question, but you were also asked to read and consider and rate the responses of others, of your peers, to that question. And the goal of doing this is to give you a chance to not just share what's on your mind, but hear what others in the community are saying, and then collectively prioritize as a group what has been shared. What emerges through that process is a window into what is most important to most of you. And that's really important for Dr. Gutierrez and the leadership team to know right now as we start this school year. So this exchange was opened less than 48 hours ago, and I have to say that I've been really impressed with how enthusiastically this community participated. Not only did nearly 800 individuals share almost 1,000 thoughts, questions, and perspectives, but you all were very highly engaged with one another's thoughts. So you rated a lot of thoughts of your peers and your neighbors and colleagues, and that's a really important component to a thought exchange. So we're actually going to open this up for a few minutes so you can share some more thoughts in the exchange. You can, if you've already been in there, you can star some of the new thoughts that have been added, and you can share any last minute responses. And then we'll take a look at the top rated thoughts and we'll use them to shape the content for the rest of this forum. So you will in effect be driving the content for the rest of this forum. So if you can bear with me for one moment, I am going to turn off my video and then I'm going to grab a link and share it in the chat. So you should see a link in the chat. You can click on that. And then alternatively, I will share my screen. And Dr. G, if you can give me a thumbs up that you're seeing my screen. Perfect. Okay, great. So I'm going to hit play and hopefully my Wi-Fi holds up. There we go. And you've got about 4 minutes to add any more thoughts. I'm going to resist the urge to talk through that couple of minutes so I can give you some time just to think and consider and rate some thoughts. So things will go quiet for a moment here and then we'll circle back as a group. So I can see the numbers climbing. We have had 786 participants weighing in on this question. Hopefully everyone has the link. I'm actually going to move forward here on our screen and you'll see some visuals. And again, my Wi-Fi is just catching up here. That's how highly engaged you are. You'll see some visuals here of this live conversation actually taking place as you interact with one another's thoughts. It's about just under 3 minutes left. So one thing to know as you're going through and rating thoughts, all these thoughts are being shown to each of you in a unique sort of randomized order. So this is not a case of first thought in gets more visibility than the 100th thought in. It's a level playing field for everyone's idea and everyone's perspective. Another minute and a half to get your final thoughts and final ratings in. Just going to refresh this. There we go. This is great. So I wonder, we might even break 1,000 thoughts in this exchange at the rate that we're going. So just under a minute left. I apologize, it looks like the visual's freezing up a bit there, but rest assured that you're all in there interacting with one another. So about 30 more seconds. And then we'll take a look as a group at the top rated thoughts, and we'll get a little bit of commentary from Dr. Gutierrez, and we'll have an opportunity to learn from one another. Okay, perfect. So thank you so much for that. I'm going to move forward to the next slide here. This is where we kind of get to see what you as a community have prioritized. And again, I'm sorry, it looks like my laptop is thinking. Um, this is the fruits of your efforts over the last 48 hours. We're going to see some trends in some of these thoughts. We'll see some similarities because the thoughts that rise to the top are highly agreed upon, and we'll also see some emergent themes as we start scrolling down. So I'll go through most of these. We might not do them one at a time, and I'll just hand it over to Dr. Gutierrez to comment on things. So the highest rated thought, this is not surprising. And again, I'm sorry, it will pop up in a minute here. The highest rated thought in the exchange that you've collectively decided is the most important is this person says, keeping teachers, staff, and students safe during these unprecedented times. Faculty is worried about their health and their family's health. This is mentally exhausting, especially with the added stressors of school.
And one of the things that we saw as we were going through this data, a lot of data that came in, was that safety certainly rose to the top. And so what I find very valuable is that we can see through this data what are the current stressors that coming from parents and from staff. And of course, safety is a priority. And for staff, for students, and the faculty is worried about their health and their family's health, and so there are a lot of stressors that are coming into play. And so when it comes to safety, I do encourage people to review the blueprint. Yes, it's extensive, it's detailed, but that certainly helps to paint a picture of what protocols will be in place. Our campuses are going to come up with very condensed versions of the blueprint, their own COVID response plans that are going to be very detailed and geared towards that specific campus. And so that's going to be helpful. But what we will have in place, we're going to provide masks for students and for teachers. We're going to provide hand sanitizers. They are going to be throughout the school. They're going to be in entryways as you're going into the building, as you're going into the cafeteria, as you're exiting. We're going to have disinfectants. There's going to be opportunities in between transitions for disinfecting to occur, as well as the social distancing. We're looking right now at about 50% of our students learning face-to-face. So that's certainly going to afford us the opportunity to be able to have social distancing in place. In addition to what I mentioned, I worked with student services today to look at purchasing dividers for specifically elementary classrooms to ensure that we take just an additional precaution. Looking at the dividers as well for office staff. So there are going to be other things beyond what we've talked about specifically in place to ensure that we minimize exposure as much as possible.
That's great, thank you. I love that this thought rose as to the top as the most agreed upon thought, because this piece here around this is mentally exhausting, especially with the added stressors of school. I think what I'm hearing in this is there's a lot of empathy right now, you know, whether you're faculty or student or parent, everyone's worried about their health, everyone's worried about their family's health, and there's this acknowledgement that it is really mentally exhausting. So lots of empathy there. Let's see what else has come up. The second highest rated thought also about safety, speaking specifically to secondary levels, and you know, the more frequent movement throughout the day there. Would you like to speak to that?
Yes, and I think that's probably one of the biggest areas of concern for our parents. And when you think about, our schools aren't small. We have over 800 kids in each middle school and 2,000 kids in our high school. So to try to visualize how it's going to look with just huge crowds is certainly worrisome. Again, as of right now, we'll be at about 50% capacity. What our campuses have in place are really well planned out traffic flows to ensure that traffic is moving one way. They have been very creative with how passing periods are going to look to minimize the number of students who are going into the hallways. So our campus administrative teams have really thought out how this is going to look to minimize what we typically see during a normal school year, to include how it's going to be in the lunchroom. And what our middle schools have done, typically in a middle school, you have 2 or 3 lunch periods. And of course they're packed. And our middle schools have created 5 lunch periods to minimize the number of kids that are going to be in one space. But in addition to the cafeteria space, our secondary schools have other spaces that they can utilize for lunch, such as a library, a gym, an open area. So beyond the cafeteria, our campuses are going to be utilizing that space as well. But I do appreciate our campus teams for thinking outside of the box to ensure that our students aren't caught in crowds like they usually are.
Absolutely. I think we'll see a lot of creativity this year in how facilities are used. So thank you for sharing that. There's some anxiety here. It seems appears to be a trend of every school that has brought students back a plan in the event of an outbreak. I know a lot of this has been outlined in the blueprint, but would you like to speak to this at all?
Yes, and I've noticed that there were some other comments similar to this. There was just a question about what the plan is, and yes, it's laid out in the blueprint. But I do want to give our parents a peace of mind that we do have a plan when there's an outbreak, and we are going to do contact tracing to determine who was exposed to someone who may have tested positive, whether it's a student or a teacher, and then making a determination on who needs to quarantine. If it's a mass outbreak in a school or in the community, then we have to look at the option of closing. And what we're going to be rolling out next week, and I shared um, a couple of weeks ago in a town hall, was a matrix that we're going to use to measure every single day based on, it's going to be color coded, 5 levels, from complete closure to 100% operating back to normal. And we're going to share that and add it to the blueprint next week. Certainly we will notify you once it's added. We will share it on our website, social media, as well as the blueprint. But it really lays out what it looks like if we are completely closed, and what indicators we are going to use to make that decision. Or if we are at 50% capacity, which we are right now, what indicators did we utilize to make that decision? And what does it need to be? What does it need to look like in order to be at 100% back to normal? And it's not only looking at trends as far as current cases within our schools, but it's looking at what's happening within our city and our county. So stay tuned. It's a very easy to follow matrix. We want it to be as simplistic as possible because we're all overwhelmed with information. And I'm pretty certain that document is going to certainly give you some peace of mind in knowing that we have data points that we're going to look at when we're making decisions, whether it's a district-wide decision or whether it's a decision about a single classroom.
That's great. I think, there's sounds like there's going to be a lot of transparency around the way that decisions are made, and there's an appetite for that in this exchange. So thank
Yes,
you.
there is. Our community demands transparency, and it's my hope that we are delivering.
Absolutely. And that's part of the motivation of running this live for you to all see and transparently see what other people are concerned about as well. So a lot more here around safety. I'm going to call up this thought here, if I can. We did have pretty high staff and teacher participation in this exchange. I don't know if this came from a parent or a teacher, but I'm worried that teachers will be overwhelmed by trying to give virtual and in-person lessons. It will be even more taxing on teachers and their families to burden the double work and excessive lesson planning for both virtual and in-person students.
Yes, and this was actually one that I pulled this afternoon during the staff town hall. And what I spoke to was, we're all trying to navigate the workplace and how to operate during this pandemic. It's not unique to Seguin ISD. Your grocery store is doing this. Your local law firm is doing this. Your hospital. Everyone is trying to figure out how to operate and doing the normal day to day on top of the work that's coming because of COVID. And what I shared with the staff was, we've got to keep in mind that one, this is temporary. We're all doing what we normally do to reopen school, but now we're coupling that with everything that's coming because of this unique reopening with the pandemic. And there are going to be situations where a teacher could be 100% virtual and just teaching kids remotely. There could be situations where a teacher is teaching just face-to-face strictly. You could be a secondary teacher where you have a period where it's virtual and the remainder of your periods are face-to-face. You could be in a situation where you're teaching face-to-face and virtual simultaneously. And that just comes with how we're scheduling. There's not going to be a perfect number of students that can help us to create that perfect situation where you're only face-to-face or you're only virtual. We're all going to have additional demands. As the superintendent, I'm doing my normal everyday superintendent duties, but now I've got the demands that come with COVID, that things that I didn't have to do in the past. But it's temporary, and it's hard, and it's going to be stressful. But I think if one thing can motivate us and inspire us, it's that our kids need us right now. They need us to go above and beyond, because so many of them have learning gaps. So many of them rely on the loving care that they get from teachers. Many of them need us as role models. Many of them need us for structure, and it's going to be challenging. And there is no perfect situation. And as I shared, we can't, even if we could hire 100 more teachers to be able to make this a perfect plan, we're not going to get 100 teachers to make that happen. And even if we could hire 100 more teachers, where would we set up their classrooms? So it's difficult. It's going to be stressful. It's going to take a lot of effort. But the one thing that I do believe in all of this is that our teachers are willing to go above and beyond. The teachers in Seguin are willing to do more. If you work in Seguin, you're working harder than anyone does in a neighboring district. Our kids have those challenges. So if anyone can rise to the occasion of what COVID is putting in front of us, it's the teachers of Seguin ISD, and they have already proven it, as they just handled the last transition gracefully, although it's not what we wanted in the spring. And I can guarantee that the virtual learning platform is going to be 100 times improved. But it's just a time where we're all going to have to do more. But what's going to be key is that we come together to support one another. If you have a team of 5 people on your second grade team, and you're teaching simultaneously virtual and face-to-face, several of you, then maybe your colleague can record the science lesson, and your other colleague can do the math lesson, and I can record the reading lesson. And don't let everything fall on your shoulders. Rely on each other. Offer assistance to colleagues. This is uncharted territory, but I believe if anyone can make magic happen for kids, it's the staff in Seguin ISD.
Thank you so much. I know that, we're at the top of the half hour allotted. I don't know if we have time to dive into any more of these thoughts, but I just want to thank everyone again for your participation. I'm just scrolling through so you can see a little bit, so much appreciation here for these town hall meetings, and for leadership. Um, uh, Dr. Gutierrez and the leadership team have access to all this data. This is a huge, incredibly valuable amount of qualitative insight that we have for this community. So thank you so much. Um, would you like to look at any more of this, Dr. Gutierrez, or are we wrapping up?
No, and I'd like to share this with our community, and one question that was posed on here a bit ago and has kind of come up through some of the statements, and I'd like to address is, people want to know, what is online learning going to look like? And I think there's maybe some frustration. We can't paint this good picture because it's not going to look like it did in the spring, and we don't have solid examples of what it's going to look like until we go through it, and no other district has gone through it. So what I'm asking for is just some patience, and I promise you it's going to be much improved from the spring, but we can't clearly say this is how it's going to look because we've never done it. Our teachers are planning for that virtual learning. So they just started today. Let's give them some time to plan, to come together and meet with their team. They've been on summer breaks. A lot of them have been writing curriculum, but I can't, I would do a disservice if I even made an effort to tell you how it was going to look without our teachers even having the opportunity to come up with their game plan. So please be patient with our teachers, and I guarantee that they are pouring their heart and soul into this work, and it's not going to look like it did in the spring. That was something we had to turn over in 24 hours. And not a lot of accountability from TA, a lot of flexibility. There's no flexibility this time around. So it's going to be a solid plan. We're utilizing our no more grading policy. And so that's what's important to know too, is it's not the easy road like it was in the spring.
Yeah, and that's certainly, with the work I've done with districts across Texas, that's what I'm hearing. It was such a quick turnaround. It was so hard to throw that together in the spring. And when you go through something challenging like that, there's a lot of learning. I know when I look at the dashboard from this exchange, there is a lot on online learning and virtual. So rest assured that the leadership team is looking at that. The teachers are working hard. And there's lots, like I said, lots of data from all of you here to look at and help inform all those decisions. So thank you.
Yes, and we are processing all of this feedback, and it's just greatly appreciated. And I'm going to have an opportunity to look at that dashboard, and what I find valuable, what I believe you would find valuable, we'll share with you all.
Great. Well, thank you so much. I'll let you have the closing words. And again, I really appreciate being here. I'm sorry that my video is off. Hello. Thank you for having me.
Laura, I appreciate you being a guest today, and for the community, thank you all again. And we've gone through this every week, and I'm just kind of sad that it's the last one, virtual town hall, at least for now, because next week we're getting ready for the back to school. But the feedback that I've received from the community is they want to continue to get regular updates in this manner, because we get so caught up in the day-to-day. And so when we have these face-to-face events, many people can't make it, but people can make it to this. So I'm listening to you, and we will plan future virtual events, and parents, staff members, everyone on here, hang in there. Times are very difficult, but have faith in the system, have faith in each other. We together we can get through this because we are Seguin strong. And before I close, I just want to say it's a great day to be a Matador. Thank you.
Thanks, everyone. Have a lovely evening.
You too.